Hello, my name is Tom Poles. I'm a medical oncologist from London. Today, I'm going to talk about the EV301 study. This is a study which compares enfortumab vedotin with chemotherapy in metastatic urothelial cancer patients whose tumours have progressed on both platinum-based chemotherapy and immune checkpoint inhibitors. This group of patients is difficult to treat. Their median survival at the moment is thought to be in the region of 8 months, and standard treatment, as in the trial, the control arm of the trial, is single-arm chemotherapy, paclitaxel, docetaxel, vinflunine. Enfortumab vedotin targets nectin. It has a microtubule disrupting agent as the payload and a linker molecule in the middle with an antibody targeting the nectin. That's the structure of enfortumab vedotin. And it's been tested in phase 2 setting in this population with response rates in the region of 40%. The randomized phase 3 trial had overall survival as the primary endpoint. The primary endpoint showed a survival advantage with a hazard ratio of 0.70, favoring enfortumab vedotin, with median survival of approximately 13 months in the study arm. This was statistically significant. The progression-free survival and response rates also favoured enfortumab vedotin versus chemotherapy. The drug worked across broad subgroups of patients compared to chemotherapy. And so overall, the efficacy was clearly superior compared to the standard of care. The tolerability profile was in line with what we expected with enfortumab vedotin. Approximately 50% of grade 3 or more toxicity, treatment-related, was observed in both the chemotherapy arm and the enfortumab vedotin arm. And approximately 15% of both arms stopped treatment because of adverse events. Treatment-related deaths were in the region of 2%, which is consistent with data for other drugs in this setting. Treatment-related adverse events of special interest, including things like skin toxicity, peripheral neuropathy, and hyperglycemia, occurred in a manageable number of patients with enfortumab vedotin. Overall, it's fair to conclude that enfortumab vedotin outperforms chemotherapy from an efficacy perspective. The tolerability was in line with expectations and is manageable. And so, in summary, this is a new standard of care, in my opinion, in this setting of patients who have previously had both platinum-based chemotherapy and immune checkpoint inhibitors in advanced urothelial cancer, which will change the way we look at bladder cancer. Enfortumab vedotin is also being investigated earlier in the disease process, and so this is probably the first step of a number of steps for this very exciting new drug. The next series of research questions for enfortumab vedotin in metastatic urothelial cancer primarily focus on moving the drug earlier in the disease process and combining with other agents. There's a very exciting frontline trial of enfortumab vedotin plus pembrolizumab versus platinum-based chemotherapy in frontline metastatic urothelial cancer. There are also neoadjuvant trials, and indeed at ASCO this year, there's also a presentation, ASCO, also a presentation of enfortumab vedotin in patients whose tumours have progressed on single-agent immune therapy. So the drug is being brought earlier into the disease setting. We need to probably know more about the quality of life associated with the agent. We're going to look at that in EV301. We should also, I think, be looking at biomarkers associated with response and resistance. So a huge amount of work to do. This new class of agent, really important in this disease.